Hi, everyone. Welcome to Lipstick and Lipo, your unfiltered guide to plastic surgery by two board-certified plastic surgeons. I'm Dr. Smita. I'm based out of New Jersey, and I've got my lovely co-host with me, Dr. Amalfi.
So we are so excited today to answer a question that we get asked all the time. And that question comes from moms, and they want to know, why do they still look pregnant even though they are back to their normal weight and they've already had their child? And it's a really simple answer. It's because you have a separation of your muscles after you have children, and that's called a rectus diastasis, or a diastasis recti. Do you get asked this question a lot, Smita?
I do. You know, it's one of those common things, like you said, and I think patients and new moms notice it after like eating, right? After they eat, they all of a sudden get really bloated, or if they're back to their exercise routine and they're trying to do planks or something like that, and they just can't, everything just sort of drops. And that's just because your core is now weakened because those muscles have stretched apart.
Yeah, it's like bloating beyond any kind of bloating that you've ever had. And patients will say, like, in the morning they wake up and their stomach is pretty flat. Or when they lay down, their stomach gets pretty flat. And then when they stand up or they're eating something salty, it's just like all of a sudden they feel like they look like they're pregnant again. Some people, it's so unfortunate, but some people say that people actually say, like, oh, congratulations, you're pregnant again. And it's so rude, and it's so heartbreaking for these women, because you guys are doing everything you can to get back to your goal weight and to be healthy and fit. And this is something anatomic that you absolutely cannot fix, but we totally can.
Right. And I think it's more noticeable in like our thinner, more active women, right? Because they don't have a lot of overlying fat or extra skin. And so you do see that separation so easily. And also when you have these women that have had twins, or, you know, have undergone IVF treatment and have multiple births, it is definitely more significant and pronounced. But like you said, there's, you know, despite everything that you're doing to sort of get back in shape, lose weight, do sit-ups or core strength, that strengthens the muscle, but it doesn't bring those muscles back together again. And essentially, you know, how do you explain what diastasis is when you're talking to your patients?
So I kind of tell them that the two muscles, your ab muscles, kind of go down the middle of your chest, and those are the muscles that make your six-pack. And when we have the baby, our uterus gets so big that those muscles essentially have to separate to accommodate our bellies as they grow. And then when we have the baby, instead of the muscles coming back in the middle, everything just kind of goes down a little bit flatter, but they stay separated or pulled apart. So it's not a true hernia, but it's a thinning of that space between the muscles. And any exercise you do, it can make your muscles stronger, but it's not going to bring them back in the middle. So it's almost like this little corset that we have on the inside that holds all of our insides in, and it's completely unfair, because after you have the babies, it keeps them separated, and it doesn't allow them to come back together. So no matter how strong you get or how thin you are, you're always going to have that pooching, because you really have a weakness of that whole central abdomen. It's super frustrating for patients.
Right. Yeah, it's frustrating because, you know, there's literally nothing you can do about it other than surgery. You know, you can continue to build your muscle strength, right? Like that will always help with your overall core strength. But if those muscles aren't like necessarily communicating with each other and really providing that sort of circumferential, like you said, that corset, right? I always tell people what we do in surgery is sort of like that internal corset. You're not going to get the full potential of building that muscle. So in surgery, sort of what do you talk to them about and how we can address that?
Yeah, so for almost all of my tummy tucks, especially in younger patients, that repairing that diastasis recti is part of the procedure. And so we really just repair those muscles and bring them back together in the middle, and we do that with stitches or sutures. And usually doctors will do that with, you know, different types of sutures, but very strong sutures, and oftentimes multiple layers, so that it's a really strong repair and we bring those muscles back together where they should be. And then sometimes even so, that separation and weakness has been there for so long that patients really have to do some physical therapy sometimes before and after surgery to just learn how to reuse their core again, because that you've had this kind of damaged core for so many years. And so you have to rebuild strength, and that's kind of the icing on the cake that gets everything as flat as can be, is that relearning. But the surgical repair is a must. There is no exercise that's going to bring those muscles back together. You can certainly learn to exercise around it so you don't make it worse. But the only way to repair it is a surgical repair.
Right. Right. I completely agree with that. And I think oftentimes, at least for my patients, and I'm sure you get this too, people may not have a lot of loose skin, a lot of that overhanging skin, or a lot of that, extra fat. So they don't necessarily think that they're a tummy tuck candidate. But but more often than not, we're able to get out a good amount of skin. But also there's other things, right? There's a mini tummy tuck. There's other ways that we can not commit yourself to removing a huge portion of skin if you don't have it, right?
Yep, exactly. Because some people are really worried about the scar. But the reality is when that skin has been stretched, we really can get a lot of skin out of patients. Even my skinniest patients, I have so many thin patients who have a big separation, and they are in incredible shape. But they're just frustrated, and the only way to repair that muscle is surgically. And then if we're going to do that, we're going to make that skin as tight as possible. Sometimes it is just a little bit of a wedge out below the belly button, but in a mini tummy tuck, you're really only tightening that skin from the belly button down to the pubic area. You're not really addressing the upper abdomen. So it just depends on where their loose skin is, but this is even a great option for really thin patients, which I think, again, like you said, that's like surprising for patients to hear, but it's also kind of reassuring to know that there's a great solution that's going to get them so flat. And that's so exciting that their little bodies just get so flat when you repair that muscle. It does hurt a little bit. I mean, do you talk to your patients a lot about the recovery and kind of time off of working out and things like that?
Yeah. I mean, I think the biggest thing, and this is when we manipulate or move any muscle, right? So whether it's putting an implant under a muscle or doing a diastasis repair, anytime we move the muscle to a new place, it wants to go back to where it came from. And so it spasms, and that's sort of the discomfort that you feel. And even, I'm sure you see this too, Ashley, like all of our big mommy makeover procedures where we're doing breast surgery and like a lift with implants or whatever, patients complain about the tummy, the muscle being tightened. But typically if you just get them on a good regimen of, and we also have medicine we can inject into long acting that we inject during surgery. So it really does keep people comfortable. But we do want to protect that repair, as you said, during the recovery period. So I think that's really where it's important to try not to use your core so much when you're kind of getting yourself out of bed, and just trying to arrest that repair so that it heals nicely in the long term.
I mean, a lot of my tummy tuck patients have had C-sections, and I do think that there's probably something that happens when they've had a C-section that creates like some scar tissue that keeps those muscles separated and prevents them from really bouncing back. Because I do disproportionately see C-section patients for tummy tucks more than patients who haven't had one. So I think something's happening there. But the good side of that is that I also really think the recoveries are pretty similar. So for a lot of moms who've had C-sections and done really well, I think the tummy tuck is pretty comparable. Like it's a little bit tight. You walk kind of hunched over and you kind of want to protect your belly, but I've had C-sections and it's pretty similar when you've had a C-section. And so that's what I compare it to for a lot of patients. And I think that helps them not be too worried about the recovery. And then, the flip side of this is so exciting and you don't have a newborn to take care of. So in a lot of ways, it's a little bit easier and more relaxing of a recovery when you just have a tummy tuck with that muscle repair.
Right. I mean, I agree. I think most people, it's not necessarily, after that initial day or two, they're not necessarily complaining about the pain from surgery. It's more of the, oh gosh, how long do I have to sleep on my back? If they're not back sleepers, or it's things like that really start to, bother people, but not necessarily the surgery itself. And like you said, just the rewards from getting your procedure and seeing your final results. I mean, everyone is just so happy and they feel like themselves again, right? I think for so long, it's all about the babies, right? Taking care of the babies. A lot of moms neglect themselves, and so I'm sure you hear this. Most patients are like, "This is like I actually am ready to do something for myself," and then they get it done, and they're like, "Oh, I'm Sarah again," or they like feel like a person again. So
I hear that. Yeah,
I'm not just a mom.
Every day.
Yeah.
I hear that every single day. And the other cool part about this surgery is that functionally, not only do you look awesome, like we're talking about how flat your tummy is going to be, but it feels better because having your core in continuity is actually really important for everything that we do, for like all the daily things that we do. From the very first time we get out of bed, you use your core. And so whether you're exercising all the time or you're just doing regular stuff around the house and in a regular job, having that restored core strength is going to make a huge impact on your life, big and small. So not only does it look good, but functionally, people do so well after a tummy tuck because that's what the anatomy is supposed to be like, and it gets damaged essentially with pregnancy. And so we're essentially repairing it, and everything is going to feel, quote unquote normal again, which I think is really like a hidden reward of all this, is that it's quite functional.
Right, it is functional, and people have less back pain. I mean, there's so many other
back
benefits.
Pain is
the back pain
one.
is a huge thing with sort of that weak core.
Yeah.
And if they're runners,
you're straining your back to compensate for this weakness because you can't fire your core normally. So that's a great point.
It's a great point. And then even, like most of our patients are very active, and so like running, all of these things, it relies on a strong core. So, the surgery does have more than just sort of cosmetic benefits.
Yeah, it's a great one all around. So even, tummy tucks are for so many patients, big and small, patients who still have weight to lose, patients who are at an ideal body weight, athletes who have no body fat and just have this muscle separation. I mean, all of these patients can have really awesome outcomes from a tummy tuck and from a repair of their rectus diastasis.
Right, absolutely. Well, this is such a great topic. I think so many people are so nervous about this or feel sort of hopeless that there's not much that they can do. So I'm glad that we did this episode.
Awesome. Yeah, so much more to share about tummy tuck, but definitely the muscle repair is sort of the hidden gem of all of this. So we're excited to talk more about it.
Yes, absolutely. Well, subscribe to our channel, guys, if you want to hear more about plastic surgery. This is your unfiltered guide to all things plastic surgery by 2 board-certified plastic surgeons. We'll see you next week.
See you next week, guys. Bye.